Hi, this is Stephen Burnett with the Education Recognition Program. And in this recording, we will be going over the high-level report. The high-level report is one of the most robust reports that I think many folks may not be aware of its capabilities. So we'll kind of dive in and give you an idea of what kind of data you can actually extract from this report. So I'll go ahead and begin by I'm in Chronicle now, and I'll just go right to the reports tab. As you'll see here, we have quite a few reports here. Each of the reports has a description along with a guide that you can download. So I'll go ahead and begin with the filter report, which is in the upper left-hand side. All right. So you'll see here that you have options here to, if you've already created reports, they'll be here in your drop down and you can just launch that report. But in the case that you haven't used the filter report, there will be no reports here. So you would start by creating a new filter report. Okay, so we'll see we have 5 steps here. The first step is naming your report, and you can do that at the beginning or during, you just want to make sure you have a name for it before you save it. And the system will prompt you to save it as you go along. So I'll just name this. Okay. You'll see it'll prompt me here to save. So that's step one. Step two is creating your filters. So you have quite a few filters here. I'm just going to go ahead and show some examples here by clicking select filters. And you'll see that there's 4 main categories that these filters fall into. So we'll see general information. So this has all of your demographics. And once you choose one, then you'll have a third option for the filter. So let's just choose race, ethnicity, is or is not. So, and here you'll have your options. And that's just one, an option for the general information. And the same goes for the other options here, type of diabetes. Okay, and you'll see here there's a green plus sign on the left-hand side, so you can add numerous filters. And just as an example, I'll just give a few other options here. So I'll choose DSMES and follow-up. Education format, that could be group, one-on-one, or a combination of both. Maybe you only want to pull participants that have completed the program. Patient type. Maybe you are using Chronicle for MNT as well, and you can indicate that in the patient chart. But this shows you, what they're being seen for. And I'll just continue on. Next, we'll go to the clinical lab data. So we'll see you'll have all your labs here. And for this section, let's just say maybe I only want to see participants that had an initial A1C greater than 9. And maybe I want to go a little bit further with that. And maybe I want to go back to my clinical data. And maybe I want to see folks that, have their most recent A1C is less than 7. And that's just an option, just an example of what the filters can do. And I'll go ahead and click one more. And this is the insurance. So if you've entered insurance, then it'll automatically populate here to choose that insurance type. So, if you've created insurances, within each patient record, this would auto-populate once you start typing in the insurance type. Or if you only want to pull Medicare participants, you can do that as well. And keep in mind that what I recommend doing is going through these filters and seeing what you can do. And we'll go through at the end, I'll show you a way to add options to this filter through what we call the cohort. So I'm just going to choose something very generic, just as a catch-all. So catch-all is age is greater than 0. All right. And keep in mind, we haven't gotten to step 4 yet, but step 4 is really you're only going to see participants that have been seen during this date range that you choose through the calendar function. So we did the catch-all for all participants, but maybe I only want to pull participants on a specific referring provider. So step 2A, you can filter this report out by provider. Okay. In step 3, we'll get to in just a bit. This is going to be connected with step 5 here when you run the report. So I'm going to go over to step 4. We've created our filters. Now we want to pull the date range. So here you can choose, any date range you'd like. Below that are additional filters. So if your program, you only want to pull participants that have had an education session encounter, you can choose that. For programs that are not documenting education in Chronicle, just, you're using at minimal capacity, only patients that have had an encounter such as a lab or behavioral goal update. Or if it's a little bit of both, you can choose the last option, which is a catch-all for both of these. Option 2, this is going to pull all patients within Chronicle, regardless of when they were seen. So this is going to be a pretty big report. Step 3, maybe you want to pull by class. These are a list of all my classes that I've created, so you can filter out by class. Okay. So next, step 5, as I mentioned before, this is where you go to run the report. So there's 2 main ways to run the report. It's either preview and export. These 2 are both the same report, just one is in a web form, one is in a Excel form. So these 2, keep in mind, these are individual. You're going to see individual patient records, not aggregate. The Delta report is mainly for data folks. It's not really helpful for the programs. This was initially created when Chronicle was created, but then we've combined a few reports and then created what we call the Delta report, or excuse me, the high level report, which is at the bottom. And so first, we're going to go ahead and see, as I mentioned, these 2 are individual reports, right? Individual records. So now you're asking, if I'm exporting this, what am I going to see? So that's when we go back to step 3. And this is, keeping in mind, this is individual. So these are all the records. Excuse me. These are all the fields you can export to these 2 reports. So maybe you want to see the patient's first and last name. You'll see other options here. The physician information. Maybe you want to see all the behavioral change objectives. Demographics. Maybe you want to drill down and see, their demographics, race or gender. And then educational information. Maybe you want to see how many initial comprehensive hours they've had. Within this range, or post initial, or follow-ups. So there's 3 options there, and you can get the hours that they've had so far for each of these participants that fit in this filter. And maybe you also want to see their initial and most recent labs, such as maybe the pre and post A1C or pre and post weight. Or it's not height, excuse me, weight. And you just choose any of these options. Just keep in mind, in order to see both the first and most recent of these labs, you want to make sure you choose both first and last labs. And we'll go ahead and click select report fields. All right. So just to give you an idea, I'm going to go ahead and deselect this because I don't know if my test program has any providers under Dr. Kent. So I'm going to go ahead and hit preview report here back under step 5. All right. So keep in mind, this is a web-based version of, as I mentioned, you can do this web-based, or you can do it through the Excel spreadsheet back under step 5. So we'll see here those options that I chose under that step 3. I have the participant's name, their A1C, most recent and initial. And over here, of course, we're missing some weights here. Maybe they're not tracking those. but we have those initial and most recent. And you can add any of those options under step 3 to this report. And again, this is the web-based version. So if you want to download the Excel spreadsheet of that same report, you just go under here under step 5. Okay. And the second option is the high-level report. So I'm going to go ahead and click on this. And again, the high-level report, you'll see here, you can run this based off your filters here I've created, or on the left here, high-level report can be a standalone report with no filters. It's completely up to you. So I'm going to go ahead and export the high-level report, and it does just take a second. Okay. So we'll see here based on those filters, and keep in mind that this report may be, helpful for sending back to referring providers, or showing this to possibly new providers, saying I can provide you this data in 6 to 12 months to promote, how great your program is and how great your participants are doing. So for instance, here we have, the high level report. It's showing me how many were initial comprehensive, how many were post initial. Maybe only folks had an encounter, such as the lab or behavioral goal update, but no education. How many have completed? How many were no-shows? And next you have your DSME methods, report. So it's showing like your number and percentage of groups versus one-on-ones or both, instructional hours, average hours of DSMES. And if you're familiar with the ERP renewal application, then this data looks probably very familiar. Next, you have your patient demographics. So we have your age, special needs, and then race, ethnicity, diabetes type. This data can be great for your population assessment. Next, we have your barriers to care. All right, then next we have your behavioral outcomes. So, and before we get into these reports, you'll see here that there's a little ampersand there with the number next to it. This is showing you what field's underneath it. It's what it is. So if you ever have questions, you just kind of go down here to the key and match that number with what you're looking at. So, here we have the average behavioral goal. Next, we have the number of folks that have chosen this goal, and the goals are in the middle. So for instance, I have 11 participants that chose nutrition. To the right is your actual degree of change. So out of these 11 folks, I only had 3 folks that had a follow-up on that behavioral goal. And within those 3 folks, there was a 66% positive change. So on the left are all the people that chose the goal. On the right are the people that have that goal documented and have a follow-up. So it gives you your aggregate change. Okay, next we have your clinical outcomes, your quality of life measures. Again, you'll see these numbers here. Down here is your key. So on the left are all your labs. Next you have your average of that lab. Next you have, just like the behavioral goal, how many participants chose, were documented for this clinical outcome. And then just like the behavioral goal chart to the right, looks like I have 3 folks that fit in this filter that had an A1C documented, but only 2 had 2 A1Cs documented. So they had a baseline and a follow-up on that lab value. And then with that comes your aggregate change. So we had a 1.4 decrease between these 2 participants. Okay, next you have your additional clinical measures. We have quite a few additional measures here on the left, such as A1Cs, 2 or more A1Cs, A1Cs above 9, A1Cs below 9. To the right, your actual participants showing a decrease. So out of my 3 participants, there was 100% decrease in A1C. I don't have a lot of other labs here, just depending on who fits in this filter that I chose. But this will show you your actual percentage of decrease in those measures. Next, you have your health insurance, with primary insurance. Primary is Medicare, and as well as with secondary. And next you have your top referring providers. And this show you the percentage and number of referrals. And then back to the top, as I mentioned before, maybe you did have this one participant that did not have education, but they did have a behavioral goal or lab update. Down here, back to the bottom, it's going to show you that participant ID number. So if you wanted to check and see why they didn't have education, you can do that by searching by that ID number. And then below this is just the key for all the terms that you'll see, terms and definitions throughout the report. And again, I chose this as a filter through the filter report, but over on the right, you can do it as a standalone report without the filters. And then you can download this as a PDF. So I'm going to return back to the report's main screen. You'll see I just saved my report. And then you'll see now it's going to appear over here on the select filter report. So I can come back and run this report at any time. And as I mentioned before, with the filter report, if there are, maybe there's a group of participants that don't fit into any of those filters, but you are following their outcomes or maybe individual measures. I'm going to go back to the patients tab. And we have what's called cohorts. So this could be for a group of participants that need to be tracked specifically, but there's no filter for that, for those groups. So for instance, maybe, if there's participants, not taking insulin versus taking insulin, those are not current filters in the report. So you would create a cohort, I'll just do an example. And then if you already have participants in there that are fit into this, you can drop them into the cohort. Or when you create a new patient, if you're new to using Chronicle, I'd recommend definitely checking the filter report to see what filters may be there or which filters that you need but are not in the system. That way you can kind of brainstorm all the, cohorts you need to create. And as you create new patient records, you can assign them here to the cohort. And if you're going back into other participant records to add them to cohorts, you just go into the chart, see cohorts here. This one has quite a few cohorts because participants can be added to more than one cohort. And I'm just going to go back to the filter report. In step 2, select filters. To go by cohort, you would choose general information. Cohort is, and this has all my cohorts in there. So any cohort you create will be added to the filter report. So just think of it as adding filters, and then you can run this report based off of those cohorts or cohort rather. Okay. And as I mentioned before, the high level report can be run right by itself. Here, you'll have the option here, but as a quick way, let's say you're coming back to and you want to use a filter report that you've already created and saved. So, you have your reporting period, your inclusion criteria, which is whether they've had education or not. And then you have all of your filter reports right here. And then you just update report, and then it'll generate your report here. And I also recommend just going through a few of the other reports, the patient status report. This report will show you, how many participants, do you have with assessment, without an assessment, how many are inactive, how many total, and then how many have education and assessment and education complete. Again, there's a key here at the bottom. The ERP side report, I do not recommend running. We're going to be sunsetting that. We combine the ERP side report with the Delta report to create the high level report. So if you're going by data, I would always remember to go by the high level report, especially if you're looking for aggregate outcomes. Patient behavioral change objective. Again, each of these reports have a date. I'll click run. And it's just thinking. While that's thinking, I'm just going to go to another report. Oh, there we go. And the behavioral objective change report is really what I kind of call maybe like a reminder to follow up on goals. So on the left-hand side, you have all of your participants that fit into this filter. And then you have the number of them without follow-up on the goal. And then you have the number with follow-up on the goal. So let's say if you had here, it looks like I have follow-ups for all of my participants, except for Hollywood, which has a behavioral goal set, but no follow-up. So that it's just kind of like a report that shows you how many participants have a baseline on a behavioral goal, but they don't have a follow-up. And that could be maybe they're lost to follow-up, or maybe, maybe it's on the schedule to give them a call. This just shows you who has a baseline and no follow-up on a specific goal. Educator hours report. So this shows you, all of your educators that taught during this period here and how many minutes. So you'll just need to translate the minutes into hours in order to get the hours. And then for Chronicle Pro, if you're currently using Chronicle Pro, we have the educator hours detailed report. So this really breaks down the hours based on one-on-one, group, combination, or follow-up. Again, has your date there. So this really breaks it down. Okay, so these are all my educators that taught during that time. Total time in minutes. But then it breaks down to how many were one-on-one session. Like, so for instance, Mr. Testing Name did 210 minutes of one-on-ones. And then it breaks it down to 10 sessions that they taught during that time. Group education, 450 minutes. And that was including 13 sessions. And then combination time. And then you can't forget, if you're using the follow-up summary, did 150 minutes of follow-up, and then that included one follow-up session. So this really gives you a good idea of how much time, your team is spending with the participants. I know oftentimes folks, administration may question, there should be a certain percentage of time teaching and certain percentage of, charting, but this really shows you how much time during this period that the educators are teaching. No-show report. This really just shows you the number of no-shows and who was documented as a no-show. Hospitalization, ER visits. I don't think I have any data here, but it'll show you the percentage of decrease in hospitalization and ER visits if you're documenting that in front of you. Okay, and before we end, I just want to, highlight if we have any new users, on the upper right, if you ever have questions, you have your support where you'll email erp@diabetes.org. Under user training, we have all of your Chronicle user guides and your assessment forms and the reports like we just went through. In the Chronicle initial comprehensive cycle, this shows you the A through I cycle, where to document. The newer version is Chronicle Pro walkthrough guide, which basically goes through Chronicle Pro and goes through elements A through I through the cycle. And it really shows you, if things aren't turning green for you, it'll explain, what needs to be done in order for that to turn green. Okay, well, thank you so much. And again, if you have questions, please email erp@diabetes.org.